All right, good afternoon, everybody. Welcome to the City of Toronto's COVID-19 media briefing for Monday, February the 22nd, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you, and good afternoon. We are all preparing for the day when we can reopen safely and stay open safely. I wanted to start the update today with some good news and some encouraging news as we work to achieve that goal. We are seeing a decrease in COVID-19 cases in Toronto long-term care residences, and this is the first sign that our vaccination efforts are having a positive and a significant impact. According to Toronto Public Health, we have seen a substantial decline in percent testing positivity among long-term care home residents, as demonstrated by the downward trend from 10.9% positivity as of the week of November 1st, 2020, to 0.6% as of the week of February 7th, as the vaccination rollout continued. As you know, the vaccination of long-term care home residents across the city by our healthcare partners began December 31st, and administering the second dose of Moderna for residents and staff was completed as of February the 16th. This is a good sign when it comes to the effectiveness of the vaccine. It shows the difference the vaccines will make when we have enough supply from the federal government and we can accelerate the further rollout. Our work to support the provincial and federal governments when it comes to vaccinations is continuing, all of it being done within a framework and a set of rules set out by the Government of Ontario. And that is why we need people to keep following the public health advice right now. Wearing a mask, keeping your distance from others, and staying home as much as possible stops the spread of this virus and the variants. We know from the latest traffic and cell data, mobile phone data, that people are in fact starting to move around more, perhaps thinking incorrectly that improving case counts mean that is okay. Unfortunately, it is not okay, and we have to redouble our efforts for just a bit longer to show the virus and its variants who has the upper hand and who's going to keep the upper hand until we can end the lockdown and move forward to a more normal life. I received a report from Transportation Services here at the City Hall this morning that showed that citywide traffic volumes during the morning peak increased significantly last week, probably as a result of the return to school. This was a similar change to what was observed at the start of the school year last September. It showed average travel times across the city were also higher last week, which staff believes may have been driven by the heavier snowfall during the course of the week. The lockdown has been working to reduce the number of COVID-19 cases in our community. But please, don't get complacent or give up on this work. And I know it's work. It's work to change your habits and to keep your habits the way they've been for so long now. But I can assure you that the changed behavior on the part of the vast majority of people in the City of Toronto is making a difference at keeping people healthy and at stopping the spread of COVID-19. We need to stay the course over the next 2 weeks. I am very determined to see that Toronto can start a transition at that time and not later. But that rests on the health advice. I am confident, though, that we can find a way. We can find a way to open safely and to stay open, which is extremely important that we can stay open. I think we need more of a plan to accompany that transition, including much more information for people about things like ways to shop smart. Ways to shop smart. Only go shopping once a week. Make it an efficient trip. Don't make it a family outing. Make it stuck to getting essentials, and please don't region hop. These are all things that are relevant today and will certainly be relevant as we move ourselves towards reopening. Throughout the pandemic, we have been committed to helping our city's restaurant and bar industry wherever we possibly can, to do everything that we can as a municipal government to support them and give owners the best chance to protect their businesses. That's why we created the Cafe TO program last year and why we are bringing a bigger and better version of the program back this year. We've needed to be creative to give businesses the conditions they need to operate, to help protect jobs, and to allow businesses to follow at the same time the all-important public health orders that are in place and that are keeping people healthier and saving lives. Cafe TO is a program that allowed hundreds of restaurant and bar operators around the city to safely expand outdoor dining options into curb lanes, onto sidewalks, and into some parklets last year. It helped to build capacity, to allow businesses to respect physical distancing at the same time, and allowed those businesses to generate much-needed revenue. The support and input from the business improvement areas and local and restaurant and bar operators has been and will continue to be a very important part of the success of the program. The Cafe TO program in 2021 will feature improvements such as a clearer registration that begins earlier, an enhanced program guidebook, quicker curb lane installations, a renewed commitment to accessibility and safety, better communication with operators and encouragement to widen the participation in places like Scarborough, Etobicoke, and North York, and the potential for temporary platforms in some more locations. Today, I am pleased to announce that the first round of registration for this year's Cafe TO program will begin this Friday, February 26th at 9 a.m., 4 months earlier than the process began last year. By opening registration on Friday, it means we'll be ready to help restaurants take advantage of the entire summer, because new curb lane cafes, for example, will then be able to be in place by mid-May. And that's almost 2 months earlier than last year. Many restaurants that are approved for curb lane cafes during this first window of registration will have access to that extra space to generate revenue and please their customers before the May 2-4 long weekend. If you ask most operators, they will tell you that long weekends in the warm summer months are critical opportunities for their businesses. And if we all continue to do the right thing, and I know many have been trying their very best to follow public health advice with their own personal behavior, we can expect that prevailing health conditions should allow for safe outdoor dining. That's what we want. We want to get through this lockdown, make sure it is the last lockdown, and move forward safely and for the good health of everyone involved. Restaurant operators interested in applying for this year's program should have their information ready and should visit the Cafe TO page at toronto.ca/Cafe TO to sign up come this Friday morning, February the 26th. This week, the City will also be releasing the new and improved Cafe TO guidebook that will outline details for this year's program, including important safety and accessibility information. City staff are planning a webinar for local operators on Tuesday, March 2nd at 9:30 a.m. The webinar is for all operators interested in being a part of this year's program and will review program improvements, the different requirements, and help answer any questions that operators may have. And I continue to encourage all restaurant operators to add their restaurant to togotoronto.com. togotoronto.com is a site that was created by the city and by Destination Toronto, and it provides a free listing that lets people know where they can order takeout or delivery food options, and eventually it will also list patio locations. So again, that's togotoronto.com. Cafe TO has been a tremendous program that has helped our Main Street restaurants and bars. And I'm so glad that we're bringing it back with improvements, because I know that it can help the restaurant and bar industry that have been hit so hard and improve at the same time the livability and the enjoyability, if there is such a word, of our city in those precious summer months. It is an example of the work we will be doing to help people to open and then to stay open in a successful manner once the time comes. In my view, the transition to a more open stage will require a more complete plan than ever if it is going to work, so that we don't have to close again. As I said earlier, this will involve more and better public information on how to shop smarter and visit retail smarter and safer. It will involve better workplace practices to protect people, and much more rapid testing in more places, including in workplaces. We will be working with Toronto Public Health and the province on this, and I hope that we'll have more to say very soon. Yes, I am cautious as your mayor about the road ahead, because I don't believe you can gamble with public health or the well-being of the healthcare system. But I'm also an optimist about our battle against the virus, about the vaccines, but about our city most of all, and the people who live here, who I know will focus their attention on using the next 2 weeks to bring this lockdown to an end and to make sure that it is the very last lockdown. Now I'll ask Dr. Davila to offer her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 366 new cases of COVID-19. 10 people have been admitted to hospital, bringing the total to 337, and 64 people are in the ICU. Sadly, I'm reporting 2 new deaths. There are 71 confirmed variant of concern cases in Toronto. 70 are the UK variant, B117, and 1 is the Brazilian variant. 511 cases have screened positive for mutations and are expected to be confirmed as variants of concern. There is encouraging news to report on vaccines and also from long-term care homes in Toronto. Public Health Scotland has issued a study showing that by the 4th week after receiving an initial dose, the Pfizer vaccine reduced the risk of hospitalization from COVID-19 by up to 85%, and the Oxford AstraZeneca vaccine reduced the risk of hospitalization by up to 94%. As well, the protection was above 80% for people 80 years of age and older. And as you've just heard from the Mayor, our data shows that the percent positivity in COVID-19 tests from long-term care homes has dropped significantly, and we are seeing fewer cases in these settings. This is extremely good news. It demonstrates the effectiveness of the vaccines and the efforts by so many people and organizations to drive down spread and protect the people living in long-term care and retirement homes. Last week, I said that while indicators seemed to be heading in the right direction, there were also warning lights flashing. I want to illustrate those warning lights today because by delaying a move toward reduced restrictions, we are taking steps that will allow us to make future decisions with confidence and steps to protect the ground we have gained because the virus still has the upper hand. The percent positivity rate in COVID-19 tests in Toronto is 4.8%. That is too high to feel good about. If our approach is slow and sure, it will change for the better. But we have seen before, here and elsewhere, that given the chance, the virus will take ruthless advantage of the upper hand and spread again, likely rebounding worse than before. The variants of concern strengthen its ability to do its worst, and in Toronto, we are seeing a steady increase in variants, particularly the UK variant, B117. On February 15th, I reported 39 cases where a variant of concern was confirmed. Today, the total is 71 in a week. The more telling number is the cases that have screened positive. Confirmation of a variant is a slow laboratory process that takes between 7 and 14 days for each confirmation. Typically, a case that screens positive is eventually confirmed as a variant. So the screened positive cases is the number to watch, and that is why the extension of the stay-at-home order is so important to determining the safest path forward for Toronto. I first reported the screened positive figure on February the 18th at 341 cases. The total rose the next day to 384, and the next day to 438. It was 456 yesterday, and it is 511 today. Each day, it has increased, and I remind you about the nature of exponential growth, which is what we're dealing with. Exponential growth is a steady, stealthy lower level of growth until a point where infection rates explode, and the only real option is to ride out that wave of disease and hope for the best. In the United States, The death toll from COVID-19 will pass 500,000 people today, if it hasn't already. In Toronto, we have now passed 2,600 deaths. Since February 15th, we have reported 2,951 cases of COVID-19 in Toronto and seen almost 130 people admitted to hospital. We are not out of the woods yet. Many of you will have heard of Dr. Michael Osterholm, one of North America's foremost epidemiologists and a member of President Biden's Transition COVID-19 Advisory Board. Dr. Osterholm publishes regularly on COVID-19, and I respect his expertise. He likes to compare the threat of the variants to the idea of an incoming hurricane. And in real hurricanes, we've seen this tragedy time and time again. People know it's coming, but they act too late, or they don't act at all. We all know what happens as a result. 3 days ago, he offered this with regard to the UK variant in the United States, saying, "We're beginning to see the number of B.1.1.7 variants double every 10 days. This is exactly what happened in Europe before we saw the major surges." In Toronto, we have these amazing vaccines coming, slowly. And I know that there is a lot of understandable feeling about that. Nonetheless, they are coming, and certainly Toronto has put a massive amount of effort into being able to get you your shot as the supply grows. Medically, there is concern that variants could reduce the efficacy of the vaccines to some extent. The data aren't clear, but the risk is. At the beginning of my remarks, I told you about percent positivity rates that are now under 1% in COVID-19 tests from our long-term care homes. That's the power of vaccines. That's what I want for all of us. But in the meantime, we want to minimize the risk of diminishing their power to protect us. Yesterday was a beautiful day in Toronto. It was the kind of winter day that makes you yearn for spring, as well as the end of this pandemic. We have to remember, despite our exhaustion, our frustration, and our yearning, that we can be our best defense or our worst enemy when it comes to the resolution of the COVID-19 pandemic. The next 2 weeks are a critical opportunity to better understand where we are going, when, and how. The central question is, how will the variants dominate in Toronto, and what that will do to us and to our healthcare system. By understanding the extent of variants, we can plan for how best to go forward as the vaccine programs are implemented. With that, I'll turn it over now to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. Our coordinated enforcement teams continue to work diligently to enforce the regulations relating to COVID-19. The city has taken formal enforcement action 2,158 times to date. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. As a result, one charge was laid against the owner and operator of a restaurant and bar, and 33 charges were laid relating to large gatherings. Toronto police officers from 52 Division also responded to a complaint of bottles being thrown from the balcony of a residential unit at a condominium on York Street. Officers attended the unit, which was being operated as a short-term rental unit, and observed 14 people having a party. 7 people were charged for failure to comply with the emergency orders, 4 people were charged under the criminal code, and 1 person was charged with offenses relating to drug possession. Toronto Police also responded to an anti-mask protest at Queen's Park this weekend, resulting in 3 charges being laid under the Emergency Management and Civil Protection Act, 3 charges being laid under the Criminal Code, and 2 arrests being made. Inspector Moyer from Toronto Police is on the line this afternoon, should you have specific questions relating to these incidents. Our immunization task force continues to be hard at work, preparing our network of city-operated clinic locations such that we are ready to go when the availability of vaccine permits the opening of these clinics. The location for all 9 of the city-operated immunization clinic sites have been confirmed, and to date, on-site setup has been completed in 5 of the 9 sites. Setup operations are now underway in the 6th clinic and will continue weekly until each of the 9 sites are ready to go. Staffing of these clinics is also well underway, and we are in the process of onboarding and training the staff required to operate the clinics. The target set for us by the Province of Ontario is to be ready to open our 9 city-operated COVID-19 immunization clinics by the 1st of April, to coincide with the forecasted availability of vaccine. All aspects of our clinic deployment plans are on target, and I am confident that we will be ready to go on or before the target date of April 1. Our immunization task force continues to work alongside our hospital and community partners on the larger citywide immunization plan, including the plans to administer vaccine to those prioritized in accordance with the provincial prioritization framework. We are pleased to see that the vaccine supply from the province is enabling the continuing efforts with respect to immunization rollout of frontline healthcare workers. This includes the resumption of vaccination efforts for our frontline paramedics, which will resume tomorrow in collaboration with Sunnybrook Health Sciences Centre and the Humber River Hospital. Also, in accordance with provincial prioritization, the vaccination of frontline firefighters who are directly involved in the response to emergency medical incidents commenced this morning in collaboration with Michael Garron Hospital. In addition to frontline paramedics and firefighters, the following groups of healthcare workers will also begin to receive their first dose of COVID-19 vaccine this week. Needle exchange and supervised consumption staff working in various treatment locations across the city, mobile COVID-19 testing teams, community health center staff, acute care workers that have not yet been vaccinated and who continue to be within the prioritized groups, and prioritized home and community care workers. Our hospital partners will be reaching out to each of these groups of people as vaccine operations get underway this week. I appreciate that there are a number of questions relating to when other members of our communities will be vaccinated, where that will happen, and what the process will be. As very soon as this information is provided to us by the Province of Ontario, we will ensure that it is communicated widely and transparently. I continue to encourage everyone to monitor toronto.ca/COVID-19 for the most accurate and up-to-date information relating to both COVID-19 response and vaccine rollout in Toronto. Thank you.
Okay, thank you very much, Chief. Before we go to questions, just a reminder to please unmute yourself, and then we can hear you. So we'll go first to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Dr. Davila, you were talking about the trends that you were seeing or that were noted in other areas, other countries, as far as seeing the average doubling of variants of concern being about 7 days. Based off of what you are reporting, it sounds like we're on track to see something similar. Is that a fair assessment? And what other trends are you seeing that you can actually point to people when it comes to VOCs in the city as to location and where these are spreading the most and what areas?
So, Matt, I don't know that anyone can really predict with any certainty. What we can do is observe that which has happened in other jurisdictions and prepare for similar circumstances to happen here. This is certainly what I was getting at in my remarks, and it's certainly what Dr. Osterholm in the United States has spoken of as well. It's, you know, like a hurricane sort of warning system. We have an opportunity to prepare ourselves for the worst, hope that it doesn't come to pass, but certainly we don't want to find ourselves in a situation where we have, you know, growth and surges and variants of concern similar to what was seen, for example, in the United Kingdom, in Ireland, in Denmark, in Germany, and in many other countries in Western Europe that we're hearing about now as well. So I can't say definitively, but certainly you know, what will happen in the future. I can say that we have seen concerning trends when it comes to variants of concern here in Toronto. And not surprisingly, where is it happening? Where there is close interaction between people, and particularly when guard is let down, when measures, distancing measures and personal protective measures are not optimally being practiced or can't be optimally practiced. These are the circumstances that allow for the virus to spread. We've now known that for many weeks, and it reinforces the advice that we continue to put out there in terms of reducing the spread of COVID-19, whether we're talking about old variant or variants of concern. Distance, distance, distance is number one. Wear your mask as often as you can, a well-fitting mask. Wash your hands, and you know, stay home when you're ill or have any kind of symptom. Get tested when that happens, and reduce the risk as best as possible for spread from yourself to others.
Thank you. And to Mayor Tory, you were talking about the cell phone data tracking people's movement. Is that going to be made public today? And also, are you tracking how people are moving out of the region? Because I know we are talking a lot about region hopping and where people can go where restrictions are a lot, well, less than we would see here. Is that something that you're interested in actually seeing, where people are going outside of our vicinity?
First of all, this is aggregated, anonymized phone data, so people who might be concerned about that should know that's what it is, and it has been supplied to us by somebody who pulls that information together. The answer to your question is that yes, we will be reporting, although there's a bit of a lag time in the sort of collection and analysis of this data, what the movements of phones have been over the last little while. Again, we've seen sort of an increased level of activity of phones, as you might expect during the summer and fall, and then some diminished level of activity, and then it seemed to be heading back up again. But we'll have up-to-date data on that in the next very short while, and the traffic data tends to go along with that. With respect to the monitoring of region hopping, the answer is yes. That's something that I specifically this morning asked to see, but you can't see it probably for another 4 or 5 days because the areas around Toronto just opened, many of them today. But we saw in the pre-Christmas period, when Toronto was closed and the outlying areas were open, that there were thousands upon thousands of people, and you could literally see that they left Toronto and went out to the regions, and specifically ended up in places like shopping malls and came back. And so there was no law against that, but certainly people had been asked and requested not to do that, and it probably wasn't helpful when it happened, but we will see what's going on now in a few days' time when we have that data available.
Okay, thank you. We'll go next to Mark McAllister from City News. Go ahead, Mark.
Thank you very much. First to Mayor Tory, and then perhaps Chief Pegg, if you could speak to this as well. And I know that you had suggested Inspector Moyer was available to speak. But first, Mayor Tory, if you could just react to the incident involving the short-term rental condo and the glass bottles being thrown from the balcony. And Chief Pegg, as a follow to that, maybe your concern of people just not following the emergency orders and getting together in gatherings like this.
Well, I think the behavior itself of the throwing of the bottles off the condo building, ranks right up there with Chairgirl as just being among the most grossly irresponsible acts that we've seen during the course of the pandemic. Having a party with 14 people is, you know, a bit down the list, but it's up there because it's against the law. And so some people have been, you know, charged in connection with that, and in connection in particular with what I think is just negligent, irresponsible behavior in connection with the bottles. And fortunately, these are just people who are, you know, just so beyond the scale of irresponsibility, it's almost unimaginable, and they're few and far between. But the bottom line for people has to be no such parties. We're going to have to take a look at how this fits within the new short-term rental regulations, because one of the things with a new set of regulations like this, they're just a couple of months old, is, you know, are we keeping adequate track of who is renting these kinds of premises and for what purpose, just so that we can make sure the intent and spirit of these rules is being followed, and that's something that we'll obviously have to follow up on in the wake of this incident this weekend.
And Mark, I'll just say this. Dr. Davila and our medical and medical science professionals have been painstakingly clear throughout COVID-19, and that is that gatherings such as the ones we described today and the ones Mayor Tory just referenced contribute to the spread of COVID-19 in our city. And to me, it's simply irresponsible, it's unacceptable, and it has the net impact of placing lives at risk, placing the capacity of our healthcare system at risk, and quite frankly, delays the day that we're all fighting so hard to get to, which is the day where this virus is behind us and we can reopen our city and our economy safely. So I applaud and certainly commend our enforcement teams. The work that they do, the work Toronto Police is doing to enforce these regulations is demanding and complicated and difficult. And I regret that it's necessary, but I appreciate all of their effort in doing all that they can do to keep us safe.
And perhaps a question to both of you again, and I apologize for splitting this up, but Mayor Tory, do you think more needs to be done in terms of policing short-term rentals beyond maybe the new rules that are in place from the city, in terms of making sure that these platforms are somehow responsible or have the ability to police during this time? And Chief Pegg, on the enforcement note, is it enough to get a complaint from somebody in that condo and then responding to that complaint, or does there need to be more proactivity? A question that we've brought to you many times.
Good work on the 3-for-2 deal there, Mark.
Thank you.
I will just say this. We brought forward and passed those regulations for a reason, and that is because there was kind of a misuse of this opportunity to have short-term rentals, both on the part of who was doing it and creating areas in neighborhoods and inside condo buildings where it was just a constant kind of circus parade of people coming through, having parties and disrupting people's lives. And so we placed some restrictions on that for a reason. And I think it's too early to say whether the enforcement activities, as we move from education to enforcement early in the new year, whether that enforcement effort has yet been enough. But we're going to be looking at it very closely, because these rules are serious. They're meant to be followed. They were put in place for a reason, which was to make sure that, yes, we could provide the opportunity for people to rent their places of residence out on a short-term basis from time to time, but that we did not want to see any longer this massive disruption of neighborhoods, and we're going to have to see how well we're doing. This is not a good example of something that, you know, happened consistent with the spirit of those new rules, but we'll have to examine all those circumstances and elsewhere to see, you know, whether we need to step up our enforcement efforts.
And for my piece, I will just comment that the city has been proactive with respect to enforcement from the outset of COVID, and we still are, literally every day. We are proactively engaged in the community and proactively inspecting to the extent that resources permit. And as we've talked about before, Mayor Tory has said, we certainly will never have the resources that we require to proactively inspect or observe inside residents and inside condominium buildings and that sort of thing across the city. It just wouldn't be possible. So we are proactively engaged to the extent that our resources permit. We are actively engaged in reactive response to complaints. That, of course, has been ongoing as well, and our teams continue to receive complaints. They are triaged and prioritized based upon the apparent risk in conjunction or in collaboration, or as an outset, I should say, of the information that's received and they're responded to. And then, as we talked about earlier, enforcement action is taken based on the the independent investigation of the responding officers based on the circumstances and conditions that exist at the time that they're there. So we're never going to have the resources, Mark, to proactively inspect or enforce every street corner or every nook and cranny of the city. There's a balance there that requires cooperation on the part of all of us to get to the desired destination.
Right, thank you, Chief. We'll go next to Ashley Legasic from News Talk 1010. Ashley, go ahead, please.
Hi there. Thank you for taking my question. Mayor Tory, today we spoke with a man who for almost a year has been putting on kind of a grassroots food drive for community housing residents in North York. He collaborated with nearby grocery stores to help feed people in those housing projects. So he tells me that Toronto community housing has been putting up a lot of red tape, like requiring him to have liability insurance when it comes to still being allowed to conduct this drive twice a month. So considering this is just one man trying to give back to his community, does there need to be all this red tape?
It's a balancing act that we always have to be concerned about in anything, because if we had no regulation or no oversight of all the activities people, conduct, then we might be criticized for that if something bad happened. But in this case, I can just say that, and we have helped tens of thousands of people with food access programs, and I commend the individual in question for the initiative that he's undertaken. And I have, I'm told that the city signed off on this at the end of last week, and I've requested Toronto Community Housing to expedite their approval of this so that we can let this man do his good work as soon as possible. So I expect there'll be some very good news that he should be receiving momentarily, and he can get on with his good work. But we do have to sometimes be careful, especially when it comes to things like food and access to that. We just have to be careful.
Great, thank you for that. My next question is in regards to coming out of lockdown. Mayor Tory, it sounds like you're cautiously optimistic. I think that's a fair way to put it, that this will happen for us in 2 weeks. What are you basing that off of? Like, what are the exact numbers we need to see in order to give the green light to moving back into the framework?
Well, the provision of exact numbers, or if there are any such thing, come from the medical officer of health and from the people who give us advice on that. My optimism is just rooted in the fact that I think people really want this to be over, the lockdown. That starts with business people, but I think right close behind them are individual citizens who want to go to their gym, want to get a haircut, want to, be able to go shopping in different places, even on a limited basis to begin with. And so the point I was making is that I'm optimistic about the ability of the people of Toronto to put in 2 more weeks of really solid compliance with the public health advice and stay home and wear masks and not socialize, with other people outside of their own household. And I think that if we do that, then there is reason to be optimistic we can begin a transition to a different place. But it's really going to depend on what people do in the next couple of weeks, and that's where I'm optimistic. I think people really want this to be over, and they get it, and they will cooperate and comply, as they've been doing in the vast majority quite well so far.
All right, thank you. We'll go next to Brian Lilly from the Toronto Sun. Go ahead, Brian.
A question for Dr. Davila. Dr. Davila, your organization suspended contact tracing, except in certain settings like long-term care, at the beginning of October. And as far as I can tell on the city's COVID-19 dashboard, still not engaged in widespread contact tracing. If we are going to come out of this, we keep hearing that is an important tool. So where is the city? Where is Toronto Public Health in terms of engaging in contact tracing, especially in light of your concern over the new variants?
So Brian, that's an excellent question, and clearly you've heard the message that I am very concerned about variants of concern and the impact that they may have. And throughout the entire pandemic, our task has always been to, as the local public health unit, ensure that we're looking at the data, looking at our circumstances, and using the best available evidence to direct our resources in those areas where they're most likely to derive the most value for those resources that are invested in different areas. And so when I look at what we've done, we started off with 50 people within our case and contact tracing. That has now grown to more than 900 people working in this area. And we've, increased the use of technology. We developed our own database for case and contact management. We have increasingly brought on new staff and partnered with other health system partners and with the province as well to ensure that we are able to do as much as possible given the circumstances. So we have invested a lot of time and effort in this, and we're going to continuously do that. That's what we do. We're constantly assessing the situation, making determinations as to how best to use resources to deliver the most value. And right now, when it comes to variants of concern, we're focusing our efforts in these cases, in variants of concern, and particularly in the highest risk settings, congregate settings where people are actually together in larger groupings, because this is where a new variant that has increased transmissibility really has the capacity to take off and explode. This is what we've seen in other jurisdictions, whether we're talking about the UK, Ireland, Denmark, or Germany. So we have, every reason to believe that that would be the same kind of circumstance we need to be very, very mindful of here. So when I look at variants of concern and when I think about their increased transmissibility, you'll note that we're focusing our efforts on that. But the best thing that we can do in order to allow for case and contact management and for vaccines, the other tools that are useful to us in these settings, to be most effective, what we need to do is to continue to keep our distance to the greatest extent possible. We reduce case counts overall. It allows for case and contact management to be most effective, particularly given that we know that these new variants are even more transmissible than what we saw before in the fall. And it also allows for the greatest opportunity for vaccines to really deliver their maximal effect and get us back to where we would like to be, which is life more like we knew it before COVID.
You didn't really answer as to whether the city is involved in doing or will soon resume mass contact tracing. So I'm wondering if you could address that, but my follow-up would be your comments on variants of concern seem at odds with the mayor's optimism for coming out of lockdown in a couple of weeks' time. So given your concern, given what we saw in the federal modeling and warnings from Dr. Tam not to lessen any restrictions, do you foresee asking for an extension of lockdown measures, or you yourself keeping them going if the province does relax any restrictions for Toronto?
So, Brian, I think I've learned for sure over the course of my practice that, best not to make, and I guess I'm not the only one who said this, best not to make predictions, or that predictions are very difficult, particularly about the future. And especially when we're talking about variants of concern, which actually have given rise to a new pandemic. This is a different phase of the pandemic, one about which we are still very much in the learning phase. The experience from other jurisdictions would suggest that certainly a great deal of caution is necessary, but I think what you heard the mayor speak of was optimism around the capacity of the residents of Toronto to do what's necessary. And we know that what's necessary in terms of controlling the spread of COVID-19, including new and emerging variants of concern, is about distance. It's about maintaining distance to the greatest extent possible. The more we are able to maintain distance from each other, to limit our interactions as much as possible to those with whom we live, the more we're able to control the spread of COVID-19 in our city, whether they're old variant or new variants of concern. And the sooner we will be able, as Toronto Public Health, to be able to more fulsomely engage in broad-scale case and contact tracing, because that is a measure in the public health toolkit that is most effective when numbers are actually at a reasonable level. Add to that the new tool of vaccines, and as I mentioned in today's remarks, we have a lot of optimism hung on those, and lots of good reason, I should say, to be optimistic about vaccines. We're seeing that even after one dose, the benefit that's conferred by these vaccines is remarkable. So I think when we put this all together, there are lots of reasons to be optimistic, but it does mean the continued vigilance with distancing, with mask wearing, with all the measures for self-protection that we've been speaking out of for the past weeks and months now.
All right, thank you. We'll go next to Mark Douglas from 680 News. Hi, Mark. Go ahead, please.
Thanks, Brad. Dr. Davila, just to follow up quickly on that comment you made about the hope you can get in vaccines and how remarkable even just one dose is. Regarding this less than 1% positivity rate in the long-term care homes now and how it shows the power of vaccines, is the vaccine exclusively to thank for this low rate today in the long-term care homes? Can they really have that much of an effect that quickly?
Well, I would never, characterize the progress that we're seeing to only one thing. Certainly vaccines have made a significant difference, but I don't think that takes away from the many practices, infection prevention and control practices, and all the efforts that have been put into reducing the potential for transmission of COVID-19 within long-term care homes. And, with that in mind, I would suggest to you that, getting us beyond this phase of the pandemic in a similar fashion will take a concerted effort. It will take a series of tools working together in order to actually really significantly reduce the spread and transmission of COVID-19 and get us to where we want to be, which is getting our city back and getting back to life more like we knew it before COVID-19 was part of our vocabulary.
You sort of led into my next question there on the topic of getting back to normality here. If the positivity rates at the long-term care homes stay as low as they are reported today, could the seniors living in these homes and their families expect a return to some kind of fuller visitation, to more open get-togethers?
Well, I think that while we're hoping for that, we are still very much in the learning phase. And the current advice right now is that even with a full 2-dose regime on board, people are being asked to continue on with the self-protection measures, particularly with an older population who we know are more susceptible to COVID-19. There are still some questions around what is the duration of the protection that's provided. Again, we're dealing with a new vaccine and we're actively learning as we go through. So for now, the best advice is to absolutely get the vaccine when it becomes available to you. And in the meantime, even after you've gotten the vaccine, to continue the measures for self-protection until we observe and have more data on which to provide further advice.
Thank you. We'll go next to Jennifer Pagliero from the Toronto Star. Go ahead, Jen.
Thanks, Brad. Good afternoon, everyone. I wanted to start with Dr. Davila. We've seen, as the stay-at-home order continues, that it's been particularly challenging, and there have been more questions from small business owners. And I'm hoping you could speak specifically to their concerns. Their feelings are in the red zone that some of our neighboring regions are in, with strict protocols on who could go in and out of businesses that would allow people to stay apart but still allow their businesses to survive. And so I'm hoping maybe you could speak to them as we continue to have this stay-at-home order in place.
So thanks, Jennifer. This is one of those questions that's very, very difficult for all of us in the realm of public health to deal with. And it's, I think, emblematic of many of the circumstances that we've had to deal with over the course of the pandemic. And I think the mayor made reference to, this concept in one of his earlier answers. And it's this question of balance, trying to find the right balance. The challenge is that we know that, COVID-19 is highly transmissible to begin with. Add to that the new variants of concern and their increasing presence here in the city of Toronto. We know that they are more transmissible, and there is some evidence that is emerging which suggests that these new variants of concern are not only more transmissible, but also are accompanied by more severe outcomes and impacts when there are infections with the new variants of concern. That is still, again, an understanding that is still emerging, but certainly there's some evidence that suggests that COVID-19 infections that are associated with these new variants of concern have a higher tendency towards more severe outcomes and impacts of those infections. So we have to keep that in mind. And I recognize that there are economic impacts and that business and income are associated with health as well. But I would say this. One, there is no such thing as a healthy economy or a healthy business without healthy people. And first and foremost, the actions and the advice, the actions that we're taking at Public Health and the advice that we provide are focused on creating healthy communities, which include healthy people, and yes, it involves a healthy economy. So to my mind, the issue now is that we're dealing with variants of concern. We have an opportunity to actually enhance our understanding and better appreciate what kind of impact they may have on disease transmission in our community before we move in a direction that facilitates interaction between people and therefore increases the likelihood of transmissibility. So I think it's a cautious step. It is akin to that being prepared for a hurricane, that we don't want to find ourselves in a situation where the worst comes to pass and we didn't prepare or really get ourselves ready for significant activity. We always, in public health, want to prevent as much as possible rather than trying to deal with a situation after the fact.
And just to go back to the contact tracing, there came a point, and I've lost track of when it was, but that it was not possible to do the regular contact tracing that we saw at the start of the pandemic, given the level of cases the city was seeing. And I heard you say in answer to the previous question that there's some prioritization of the variant cases, which I think I understand given the transmissibility of those variants. But is it still the case that Toronto Public Health does not have the ability to do regular contact tracing for all cases that are brought to TPH's attention?
Yeah, so Jennifer, for now, what we're doing, right, at Toronto Public Health, given our case counts and given the need to focus, given the emergence of variants of concern, we're focusing our resources on case and contact management, particularly on contact tracing, in those circumstances that we know are highest risk for significant transmission events. So congregate type settings, long-term care homes, retirement homes, schools, places where you have, larger numbers of people, because those are the circumstances that we know give rise to the highest risk for the individuals in that setting and for the community writ large. As case counts hopefully continue to drop, and again, this all rests on all of us being vigilant around maintaining our distance to the greatest extent possible. But if we can bring our case counts down, and even in the face of variants of concern, that will allow us to better be able to more fulsomely use our case and contact management resources. And above all, it'll give vaccines a better chance at being effective in terms of controlling transmission and spread of COVID-19.
All right, thank you. Final question is to Natalie Johnson from CTV News. Go ahead, Natalie.
Hi there. My first question is for Dr. Davila. Dr. Davila, what are your takeaways from the asymptomatic school testing results released by the province? And do these numbers actually have any value if we're not testing all of the students in all of the schools and instead doing it in smaller numbers at select schools?
So, this is a relatively new undertaking, courtesy of the province and the testing partners that are engaged. It's one that I think we're continuing to learn from. But I would say this, our current understanding of COVID-19 within our schools is that, look, whatever we're seeing within the schools is a reflection of what's happening in the larger community. And that's because schools are part of our community. So what it all comes down to in the end is our continued vigilance as a community to the greatest extent possible to minimize our interactions with others, particularly those with whom we do not live, to wear our masks as much as possible, to do all those self-protection measures that we've spoken about, that I've spoken about for many weeks and months. The more we are able to actually reduce that which is happening in the community, the more we're able to reduce the spread of COVID-19 in the community, the better off it is in our schools, and the more likely our children will be able to continue in-person learning, which we know is so incredibly beneficial for them.
Thanks. And just as a follow-up, it sounds like the province is leaving a lot up to the individual public health units as far as how people will get contacted, for example, about when it's their turn to get a vaccine, especially for the over 80 age group, and certainly while the portal is still under development. Will it be Toronto Public Health who will be contacting the people over 80 to start? What are the next steps for that age group there? How does TPH play into that?
Well, as you know, the province is responsible for creating that prioritization framework and identifying which populations should be vaccinated in what order. To date, we are, having ongoing conversations, as I'm sure and as I know other local public health agencies are having in concert with the province. Our circumstances in Toronto are not surprisingly unique in the province. We are by far the largest jurisdiction, and so working out those details around how best to implement that provincial prioritization direction is right now an ongoing conversation, and we'll look forward to being able to describe that to our residents as those details become firmed up. But it is a complicated undertaking, as I'm sure you can imagine, and what may unfold here in Toronto may not be quite exactly the same as it will be across the entire province, given our unique circumstances as the largest city in the province.
Thank you very much, everybody. That concludes today's briefing. Our next scheduled update is this Wednesday, the 24th at 2 p.m. Stay well.